In this video, we're going to talk about the biomechanics of the clavicle at the SC joint. Okay, so big picture, anytime the arm is moving into an overhead position or into flexion, the clavicle moves relatively inferiorly or relatively down. Okay? The opposite is also true. Anytime the arm is coming from a flexed position into a relatively extended position, the clavicle is moving superiorly or moving up. All right, so that's a big piece. The second component of this motion is anytime the arm is moving across the body, whether it's superior or inferior, the clavicle is compressing onto the sternum. And anytime the arm is moving away, it is decompressing or moving away from the sternum. Okay, so let's go through each of the four possibilities and say what's happening at the clavicle, right? So if the arm is moving into flexion abduction, the clavicle is moving inferiorly and distracting away. Okay, so as I'm assessing, I'm actually assessing with a infill into somewhere into this diagonal. Okay, so I'm taking her arm up, I'm on the superomedial portion of the clavicle, pulling inferolateral. All right, so as I go up, I can feel, is there a hard infill there? All right, if I am going into extension adduction, now the clavicle, as I go into extension, should be moving superiorly, and since I'm coming across the body, it should be compressing onto the clavicle or onto the manubrium of the sternum. Okay, so I'm coming across, and so it needs to move superomedial. So my force should actually be going up and away from where I'm standing, at least right now. All right, so if I get on the clavicle, I'm on the inferolateral portion of her clavicle, and now I am pushing up and away, and I'm feeling how does that clavicle move superiorly and compress against the manubrium. My words are not coming to me. Okay, so that was this diagonal. Now the opposite diagonal, flexion adduction, extension abduction. As we go into flexion adduction, we're moving up overhead, right? So the clavicle should move inferiorly, and we're coming across the body, so the clavicle should compress onto the sternum. So in order for that to happen, we need to move down and towards the clavicle. So I am palpating superolateral surface and pulling inferomedially, okay, to get compression and inferior motion of the clavicle. Now, if we are going into, and that was a hard infill actually, and now as we go into extension abduction, okay, as we move into extension, the clavicle should move superiorly, and as we move into abduction, it's away, so it should decompress. So we're moving superiorly and decompressing. So I am inferomedial, pushing superolateral as I move into extension abduction pattern. Okay, so this is very confusing when you're first learning it, but if you can just imagine and break it down into the two components, is the arm going up or down? If it's going up, clavicle is moving inferior. If you're going down, the clavicle is moving superior. And are you going across body or away from body? If you're going across body, it's compressing. If you're going away from body, it's decompressing.